once you have gotten those vaccines to the ports of West Africa, and maybe even have been lucky to get them to that outpost, then you get people saying, I'm sorry, I'm not going to actually take this.
Welcome, everyone, to our Beyond COVID series at CID. I'm thrilled to have our panelists today. I've posed sort of 3 questions to them, and as we turn to each one of them, those questions are broadly going to be kind of what the challenge they face in vaccine distribution, what are some of the positive signs or hopes they've seen, and importantly, what are their ways forward, both for this current pandemic, but also more broadly as we think about equity of healthcare services. How do we think about those issues which this pandemic has really brought to the forefront?
What are some of the key lessons that we really come out with here? The one that we have been speaking and singing as a mantra is that no one is safe until everyone is safe. We have seen how variants have really taught us that if you are ahead, but you are not actually taking others along with you, a variant may come from one space and really reverse the progress that has been made. Then the second one is that the investments that we have made in peacetime have really been a very important infrastructure that we have been able to leverage. India has vaccinated or put out doses over 1 billion, and it has used infrastructure for capturing that was developed through the routine immunization side. And so there are things that can be leveraged from our work that was already ongoing.
My area of work and my biggest concern is, okay, so if we manage to get these procured, if we manage to get these procured at prices that are acceptable or accessible, if we manage to get them onto ships, what happens? How do we get them from the ports to the patients? Because we don't want it just to get to the port. We don't want it just to get to the capital city. We want it to get to the countryside. And this is not just something that's a problem with medicines and vaccines. It's a problem with everything. So we have a gigantic opportunity here to really say, for now, let's not talk about systems, but let's really get to systems quickly.
There is a governance aspect to these areas, whether it's politics or it's logistics. My question back to you all is, as you think about these governance issues, what are positive things you're seeing happening that we can push on? And frankly, what are pitfalls you're seeing over here? There's a dark side to all of this. As much as we celebrate the successes, there are some nationalistic tendencies.
In the discovery and production phase, as many of you are aware, there's been this notion of adopting a TRIPS waiver to remove the critical intellectual property barriers in order to scale up vaccine production across the globe. Number 2 is to incentivize our pharmaceutical companies to voluntarily license the COVID-19 vaccine patent. The third is to impose a federal waiver on intellectual property related to COVID-19 vaccines within the US federal jurisdiction. Number 4, we find the idea of financing a technology buyout, where the US federal government offers these companies a lump sum payment in exchange for the COVID-19 vaccine IP. The 5th is investing, as we know, in vaccine manufacturing infrastructure. And we've seen some really creative multilateral partnerships, for example, between the Republic of Senegal and the EU. The 6th is actually supporting efforts to evaluate and implement dose stretching strategies. And remember the experience that we've seen from the UK as well as India, and where and when those should be adopted. And the last is really, how do we harmonize regulatory processes? So during a pandemic, the local trial requirements for vaccines actually are quite stringent, and which of these should be waived in the midst of an emergency?
An opportunity to actually come together and pull together has been turned into a competitive space. I'll give you an example. The Africa Vaccine Task Force, which is a very important a player for Africa, at some stage may have seen us as not necessarily supporting their goals because they were looking at finding vaccines, and we're looking at finding vaccines And it has taken us much longer to come to that point of synergy. I'm glad we are in a space where our collaboration is stronger. But if we had collaborated much earlier, we would be much further than where we are.
The world isn't a flat plane. The world has hills and troughs and valleys. Walk us through local delivery. And I know you've thought a lot about local government as well, mayors. Like who in the government is going to do this? And what is their blind spots? Is one of the blind spots going to the highway and not the village on top of the hill or in the valley? How does that work out?
You can think about how it works in capital cities close to ports, whether it be a seaport or an airport, much easier than you can think about how does it get into the hinterland where you have those kind of hills and those valleys. And even the examples that I was talking about, you have cold storage in Rwanda, close to the Rwandan airport. Why? Because, it's designed to be there so that you can service industries and you can help them trade. It's the same in Burundi. It's not the same if you move kind of 100 miles away from the airport. Getting them out into the rural areas, this isn't even talking about 500 miles from the capital city. In Mozambique, this is talking about 50, 60 miles from the capital city. Is really hard because state capability has been built around the highways. It's been built around the capitals, and a lot of other places have been left behind. You don't have doctors, you don't have skilled nurses, you don't have much capabilities in terms of equipment. You don't have access. The roads are bad. And that's the norm, not the exception in many of these countries.
What has really been challenging is when these vaccines have actually gotten to many countries, you find that age group that should be vaccinated having a cohort of those who are hesitant and a cohort of those who are willing to take vaccines. So it's almost multiple tracks that you are playing with to really try to sensitize and socialize those groups that are hesitant, but at the same time, still keeping the principle of saying no doses are actually going to go to waste. And so when we make those pragmatic decisions, what it then means is that we ended up opening vaccines to the next round of the vulnerable group than we should have. Even in these spaces where you really want the vaccines to get, so all of us can really fight here and say, well, there are some countries that have been having vaccine nationalism, and you are going to try to knock at the doors of a country in West Africa. Then once you have gotten those vaccines to the ports of West Africa, and maybe even have been lucky to get them to that outpost near a hill, then you get people saying, I'm sorry, I'm not going to actually take this. So you have gone through all these chains, and sometimes you simply never know until you actually get there that you will have that hesitancy. So it's a set of threads that we have to work at the same time.
What are the most effective models for information dissemination, countering misinformation in urban centers where societies are less cohesive and mobility is high?
One of the things I would say is I think the communication is very context specific. So I would say, you can't really say what is the best model. What you need to be asking is, how do people get information that they trust the most in the place where we are? And I think that Rebecca said, the people who should be carrying the message, maybe it's your clergy, maybe it's people from your medical community. I don't know who it is, but you need to be asking in specific places, who do people trust? And who do they trust at I would argue, at as locally as possible, right? On a day-to-day basis. Who are people most likely to trust? And we need to then engage with those people. And I think, for instance, in a lot of faith communities, the faith communities have actually been some of the harder communities to work with. And that's not unusual with public health issues. But I'm not really sure that I see governments working hard to say, here's what the message could be. Let's convince you so that you could be messengers for us. Where countries are not doing as well, where they're not making vaccines as available, is it because of money? Is it because of logistics? Is it because of capability or politics? I would argue that the stories are always a little bit different, but they always have a little bit of everything, right? And all of those things interact with each other. Sometimes I think we look at political will and we think, well, political will is the driver. But sometimes when I speak to the politicians are saying, I need to be really careful what I communicate and promise to my population. And I don't know if we can pull it off. So, I don't want to be kind of going out there and saying, this is what we're going to do, and I don't know what to do because, it's hard to make that promise. So I think that, political will, administrative capability, financial competence in a system, these things are interactive, and kind of thinking about them independently of each other, I think is not the way to go about it. I think we need to be saying that we need to be engaging with all of them, and we need to be building confidence in systems.
The vaccine mandates have worked in the United States. We view that only 34 police officers in New York City remain unvaccinated out of 35,000 police officers when we had a November 1st deadline. And so we have to remember, if we tie vaccination to people's understanding of economic security, conforming to some social norms, this is your responsibility as a community member with the rollout, we will improve the speed and the equity and decrease transmission. And I'm hoping other countries will see this example and begin to initiate vaccine mandates faster, which actually improves both equity in the longer run.
I do want to leave with this kind of positive thought, which is, as challenging as I think the situation has been, I do think there's a lot of glass half full that our panelists have acknowledged as well. And honestly, to me, the biggest half glass full is the fact that these things are being debated in ways that I haven't seen before. Debated both at kind of academic levels, as we're sitting at national levels, at international levels, at local levels, at community levels, in the private sector itself. And I think the fact to me that debate is beginning to happen and these serious questions are being asked more than they were before, I think is a unique opportunity.